This virus would probably not be on many people's radars, unfortunately, except for the fact that it causes such a dramatic outcome in infants in the congenital infections. We basically have a mosquito-borne virus that is also potentially an STD. So we know it's mosquito-borne. We know it's specifically via the Aedes mosquito, and especially the Aedes aegypti mosquito. There have been some clusters associated with Aedes albopictus, so cousin of the aegypti. And in Hawaii, we've seen this mosquito statewide, albopictus. We've seen pockets of aegypti around the world, certainly in tropical regions. We see aegypti. We see albopictus in tropical and subtropical and even now temperate climates with the issues about climate change. There are a lot of concerns that the range of albopictus is growing across the zones, and with that would mean potentially the range of reach of these diseases, mosquito-borne diseases like Zika, in terms of causing epidemics. Like many other flaviviruses, a number of people can be asymptomatic, meaning they have no symptoms. When the virus is circulating in a population, it has a high, what we call a high infectious rate, and that a big proportion of the population will likely be infected. And of those people, many of them will have symptoms. And the symptoms, though, are relatively mild. That is relative to, say, dengue. So with Zika, we tend to see more rash, but it usually is a whole body rash. Sometimes actually can be itchy. There has been association with aches and pains, so specifically joint aches and joint inflammation. There has been some association also with fever, but the fever tends to be very mild and sometimes even not noticeable. And in fact, we've seen certainly in Hawaii among some of our imported cases where people say, well, I don't even remember having symptoms or having fever at all, and they just remember having the rash. The symptoms are often very mild, and they're very evanescent in that they don't last very long. They may last, the longest might be a week, and it usually is more about maybe a few days. So it's really very quick, which makes this virus very interesting in how fast it seems to be, circulating around in a population. So if someone gets bitten by a mosquito and that mosquito then immediately bites the person standing next to them, are they going to get infected? And the answer is no. Mosquito bites an infected person, goes through the incubation process, and then a little over a week later, that mosquito then is ready to, if it's still alive, by the way, is ready to then infect others. Public health may come out with an advisory about, make sure there's no standing water, protecting, our community against, having large areas of focused concentration of mosquito pools, and make recommendations about mosquito abatement. And in some jurisdictions, mosquito abatement, mosquito assessments may be within the realm of public health. In other jurisdictions, they're completely separate and under the realm of emergency management. And so it's really critical that those two entities are working well together. As a first responders are not likely to be called to respond to a mosquito-borne disease outbreak as the initial response. But I can see where a scenario might be where public health, as an outbreak goes on, public health might need surge capacity to be able to assess a community's needs. And they may not be asked to necessarily go and assess a case, property or such, but they may partner with community partners, with first responders, to send out teams to do assessments of the community for areas where there may be heavy mosquito breeding, to determine, as a preventive measure to abate those areas. It's important to protect yourself against mosquito bites, wearing light-colored clothing. Apparently, dark-colored clothing is very attractive to mosquitoes. Covering up with long sleeve, long pants It's much better to avoid areas where there are mosquito activity for those, especially for those populations at risk, and those populations at risk for more severe issues for pregnant women. Definitely, if you can avoid going to a mosquito-ridden area, assuming you're not already living in an outbreak area, avoid traveling to areas where there are known cases of Zika transmission, avoid vacationing there. If you're really like a vector responder and there's a really heavy mosquito-ridden area, even wearing the mosquito netting can be helpful. Spraying DEET, you can spray DEET not even directly on your skin, but especially if you're covered up, spray it on the clothes so that the mosquitoes avoid landing on your clothes. And using DEET that's at least 20 to 30%, or at most, I should say 20 to 30%. Going beyond 20 to 30% is really not giving you any more protection. Basically, what it boils down to is we're seeing more and more overpopulation, urbanization. We're seeing more and more rapid travel. And so if you put those things together, and then of course there are folks who talk about climate change issues that potentially can expand the range of vectors, it makes sense that we're starting to see diseases from far-flung areas showing up in areas that we've never noticed them before, that we would never expect them before. The biggest thing is us. We need to be aware when we move around this world of the diseases that potentially we could come in contact with that can make us sick, and how do we protect ourselves? We need to get that message out to everyone out there, including, and we need to internalize it, every one of us, and to really realize that and take the precautions wherever we go. Because any one of us can be that first index case and introduce it back home. For tropical and subtropical areas, we're not talking seasonal. Like Hawaii, Puerto Rico, Virgin Islands, we have no mosquito season. Our entire year is a mosquito season. So we've seen, for instance, dengue outbreaks occurring now in Europe, instance where, wasn't known previously, but now we're seeing them occur more and more. So on any given day in Hawaii, at least, we have over 200,000 visitors coming into the state. There is no possible way we can track every single visitor, their comings and goings, let alone our own residents. That's only the visitors. I mean, imagine all our own residents who travel back and forth. And that's just Hawaii. Think about New York City, where in a day they could have over 1 million travelers. It's just not feasible, not realistic. And then aside from that, just because you traveled from someplace does not mean that you're a target, you're automatically carrying the disease. And even if you are, there's no possible way to know that while you're only incubating the disease. And that incubation period, although tends to be short with Zika, there is no test that can be done during that incubation period to definitively rule you in or rule you out as a case. And so that it's not feasible to then go around and say, well, we'll test every single traveler. Basically, it's a matter of making people aware of what the risks are with traveling, the precautions they need to take, and how to monitor themselves and what they should do once they potentially develop symptoms. For travelers coming back to their home, where their home may be, like Hawaii, a place where we have mosquitoes that potentially could perpetuate disease transmission, it means that you monitor yourself for the next 2 weeks after you return, and you make sure you avoid being bitten by any of our mosquitoes. And if you develop symptoms, especially avoid the mosquitoes, and make sure your healthcare provider knows so that you can get tested so we can try to confirm whether you do have the disease or not. And that is the biggest message, I think, of overall. Mosquito prevention aside and all the other things aside, that is probably universal. It should be universal. I think ongoing training and education is absolutely critical for everyone. Physicians are always required to constantly train and be educated with our continuing medical education credits. You can ask my staff, I'm always saying that everyone else needs to also have it in some shape or form, whether it's for your profession or other things. With regard to diseases, we have so much information available to us. Sometimes it's information overload. So first thing is make sure when you do find out about things or try to find out about things that you're getting it from a credible source. So the Centers for Disease Control and Prevention are a great source. The World Health Organization are a great source. source. Your local public health is a great source of information. Your doctor is usually a great source of information. Getting educated on what the potential risks and diseases are out there, and not social media, not just the random internet. There's so many things out there, and there's so many folks that purport themselves to be experts that you really have to be careful and just make sure that you do get your information from credible source, that you do get training from credible sources. But I do advocate very strongly for everyone to be updated constantly on what's going on in our world today. We're living in a global village. We can't avoid things, even if you don't travel. Inevitably, something will come to you at some point. So it behooves us all to be aware of what's going on in our world and how to protect ourselves in general.